state's mental health programs. My name is Bethany Lilly, and I'm a policy attorney with the Bazelon Center for Mental Health Law. The Bazelon Center is one of the founding partners for a briefing that we annually hold in honor of Children's Mental Health Day, usually around the beginning of May. Our other founding organizations are the American Academy of Child and Adolescent Psychiatry. Michael is in the back of the room. He'll give a wave. Mental Health America, and Debbie is always very noticeable by the National Alliance on Mental Illness, NAMI, represented by Darcy and Emily, who are right there, and the National Federation of Families for Children's Mental Health, and Laura and Joy are right there. So thanks to all of our organizations for setting this up, but also for Representative Grace Napolitano, who is always a champion on these issues, and I'd like to invite her up to give a bit of a welcome. Just as a bit of background, Representative Napolitano was first elected in 1998 and has served since. Okay, I will just turn it over to you then.
As many people know, I hate bios. Look me up somewhere. But I really thank all of you, especially the advocates for the mental health, illness and assistance and everything. This is an ongoing thing that we've done for continue to do it with your support naturally. But there's some people really that stepped up to the plate and have continued to give their time, their talents, and connected us. And one of them is Jill Diamond from the World Boxing Council, that she's got the fighters wearing the green ribbons and the promoters and dedicating to mental health awareness. And doing research in trauma to the head. I mean, these are things that they've started over a decade ago with UCLA, trying to get to the bottom of these issues. So, but to our panelists, thank you so very much. To our advocates, thank you for hanging in there with us. To all of you who are here, stay tuned. We need your help. We need you to be able to carry the message, whether it's to your offices, to the constituency. The more we talk about it, the more we're advancing reduction of stigma, which is one of the we face. And I see the mother of she was with us this morning, who's here because she has a child that had problems. We all know somebody, or at least somebody. We all need to unite. We be able to connect where they can get assistance to be able to deal with these. And I know people call me, I direct them to people that I know, and somehow this needs to be moving forward so that those people can advocate for the reduction of stigma and the funding to do the things that we need done, especially for Mental Health in Schools Act, okay? It's millions of Americans are affected. We don't need to tell you that. And you know the symptoms. How many of you know some of the symptoms of a mental illness? Anybody? Raise your hand. Well, we want to teach you some more of that, and as we move along, we'll be doing that, hopefully. The month of May will and does draw attention to the illness itself, to reducing the stigma. Please, if you can, wear the lime green. Can you tell I'm wearing lime green? I tell people, do not be afraid to speak up. Take action, take a step, seek for anything else. And on my bill 1211, most of you already know it. If not, you can just pick it up in my website. This is the 4th Congress we're introducing it. We now have 2 Republican members that are smart enough and brave enough, Gibson and Katko, that are joining us in trying to get some funding for this bill. It's a bipartisan now. We have 26 schools in my district that we started the program that this bill was patterned after. So far, no attempt at suicides, which was suicide prevention, aimed at the children in schools on site clinicians. We must start them age so that as they grow into productive adults, we don't have as many problems. We need to communicate your involvement. We need to network, so please network with the people around you. Learn the warning signs, the extreme changes in behavior, the verbal clues, etc. We must continue to educate our general public, especially parents, to be able to seek help. The National Crisis Hotline is 1-800-273-TALK or 8255. It's a 24-hour confidential hotline and assists veterans too. Now, you have packets that if you have any questions, please don't hesitate. I'll make this short because you need to hear from the folks up here. So thank you very much. God bless you for attending.
And without any further ado, we'll move on to our speakers because they're sharing with us, and we'd really like to hear from them. Our first speaker will be Kana Enomoto, who was appointed in August 2011 as the Principal Deputy Administrator for SAMHSA. In this capacity, Ms. Enomoto serves as the Principal Advisor to the Administrator on policies and programmatic activities with more than 600 employees and a fiscal year budget of approximately $3.5 billion. Ms. Enomoto brings 23 years of experience in the behavioral health field, 15 of which have been in federal service at SAMHSA. And I'll just turn it over to you right now.
I don't like bios either, but I don't quite have the gravitas of Congresswoman Napolitano to pull it off. That's right. Thank you so much, Congresswoman Napolitano. You are a beacon of hope for those of us who are champions for mental health, particularly the mental health of children. You've been such a great spokesperson for us and a leader in Congress, and this is a time when we need it the most. So we at SAMHSA, the administration, Administrator Hyde, and I really owe you a debt of gratitude. I'm not here to lobby, but if anyone would like to educate their members about the importance of these programs and the costs, yes. And by paying attention to children's mental health, we will save money. I think that is the bottom line message as well. It'll also save lives. And also the organizers of this event have been stalwart friends of SAMHSA. We support your mission, and we know that you support ours. Thank you so much for this convening. It's exciting. We all believe in the promotion of mental health, of resiliency, early access, and fostering recovery for young people. And today, thinking about what the important role is of schools in that space. We've been at this event before, SAMHSA, and we're very happy to be here again, particularly as National Children's Mental Health Awareness Week is next week, when I'm going to be wearing my green. I only have one dress, so I have to parse it out. But no, and we hope that everyone joins us on May 7th, and there's a flyer at the front. Maybe most of you know, but many people really don't know the prevalence of mental illnesses, serious emotional disturbances, and substance use disorders in our nation. And data are telling us that 1 in 4 Americans at any given time is experiencing one of these conditions. And so when we hear that 68% of people wouldn't want to live next door to a person with a mental illness or have a person with a mental illness in their families, all they need to do is look around. Right? Because 2/3 of Americans will be sorely surprised to find that they may be married to a person with a mental illness, they have a family member with a mental illness, or they have a neighbor or a coworker with a mental illness or a substance use disorder, and they don't even know it. And we have to make the change. We have to change direction. We have to talk about it, and we have to raise awareness so that people don't treat these as special or different, or that they're special in that, you know, they're very fundamental to our success in life. And they're not something to put away. We don't shy away from people with diabetes. We don't shy away from people with cancer. We don't shy away from someone with a broken leg. And so we shouldn't shy away from a child or an adult with a mental illness. And yet we know that 1 out of 10, our NISDA, our National Survey on Drug Use and Health, found that 1 in 10 adolescents suffered from a major depressive episode last year. 1 in 10. And how many do you think got treatment? Some of you know. How many? Who knows? Less than half, 38%. Only 38% of kids got treatment. And depression is a life-threatening condition. We know that. And with any other life-threatening condition, would we find it acceptable that only 38% of children got treatment? Absolutely not. And so we need to get this message loud and clear to everyone and anyone who can help us with it. The human costs are incredible, over $250 billion a year for untreated mental illness, for mental, emotional, and behavioral disorders among youth. And we need to create healthy environments in schools, and we need to prepare the teachers, the administrators, the family members, the parents, everyone in schools to surround our youth with the environments they need to thrive, both academically and in life. So we at SAMHSA are very grateful for the incredible research that's out there that tells us that early intervention, that prevention, that promoting mental health in schools, in colleges, and in universities, it works. It works, and we can do this. For many years, for over a dozen years, with the support of Congress, SAMHSA has funded the Safe Schools, Healthy Students program, where we have put over $2 billion into local educational agencies, as well as, and most recently, in state educational agencies, to foster 5 major components of a program which have been documented by the Institute of Medicine: safe school environments and violence prevention activities, alcohol and other drug prevention activities, student behavioral, social, and emotional supports, mental health services, and early childhood social and emotional learning programs. And these programs are showing great outcomes. With this investment, the president has decided to try to take this program to scale through his Now is the Time initiative and Project Aware. Because what we saw in our Safe Schools, Healthy Students grants was that the number of students receiving school-based mental health services doubled. The number of students receiving community-based mental health service went up by one and a half times, 143%. And nearly 90% of staff in schools said they were better able to detect mental health problems among their students after their school district had implemented the Safe Schools, Healthy Students program. We also found that the number of kids who said that they had been in a physical fight at school went down. It went from 19% down to 13%. And we know that actually the experiences of violence by our young children are startlingly high. Substance abuse, similarly, was reduced from 24% to 18%. So by creating these healthy school climates, by doing these positive emotional supports in schools, by giving access to supportive services, partnering between schools, criminal justice, juvenile justice, community organizations, and community mental health, we have, and family members and youth themselves, we have created healthier communities. With Now is the Time, which was born after the Sandy Hook Elementary School tragedy, the president proposed funding for programs to protect our children and our communities by increasing access to mental health services. With the Project Aware that I mentioned, we've funded 20 state educational authorities at about $2 million per year for 5 years to develop the necessary systems in their state school districts, again, using 3 pilot school districts, or LEAs, because we have this model that worked with $2 billion and 12 years. No state was doing Safe Schools, Healthy Students statewide, even though we had the results, even though we had the data. And so that's where the president has put his support behind Project Aware. We also have 100 Project Aware local educational agency grants, which is for schools and school districts to work with their communities, with parents, with youth, to promote mental health first aid and youth mental health first aid to increase behavioral health literacy, so people know the signs. People can detect these things early, and we know that early intervention is very important. We're, of course, working hand in glove with the Department of Education and the Department of Justice with their Now is the Time programs, because we know that all of these systems have to work together, because kids don't live in a vacuum. They don't just live in our families. They live in ecologies. And we have to partner at the federal level with all of those agencies that have a role in fostering a positive ecology for every child. Another place where Now is the Time is emphasized and where SAMHSA is really proud of our work is in Healthy Transitions. That's a new program that we got in 2014, and that is fostering connections for those kids that are 18 to 25 or 16 to 25 as they're at that very precarious stage of life. Not only do we know that half of all mental disorders show up by the age of 14 and 3/4 by the age of 24, so there are some kids that are first experiencing the signs of illness at this very delicate time. We also know that kids who are in youth serving systems and are already being served have challenges transition to the adult serving systems, and the danger is that they can fall through the cracks if they don't get the services and the supports that they need, that their parents don't get the peer supports that they need to successfully navigate that transition. And so we're really pleased with the $20 million that we have for our Healthy Transitions program. Another effort that most of you probably already know about is our very successful and long-standing Systems of Care program, or our Children's Mental Health Initiative, which has served kids up to the age of 21 and their families with serious emotional disturbances. This program has had an impact on millions of America's children by funding state and local agencies, tribes, and territories to develop, implement, and sustain services, wraparound services for children and their families that bring together schools and parents and churches and synagogues and youth groups and others everyone who is touching those kids, child welfare, everyone who's touching the kids and can be supportive and make sure that those children are getting all the things that they need around their communities. Holistic approach, which we also wanted to take to the tribes, and so we've had our Circles of Care program, which builds off the Systems of Care program, but allows tribes to define their own system of care for wrapping around their youth. Because we know that tribes are sovereign governments, and they have their own traditions, their own languages, and they need to be able to form a service system that works for their youth. Over the past 17 years, we've seen incredible tribal communities mobilizing and developing tools necessary to plan for the particular needs of their young people. As we move early on the trajectory, SAMHSA is really proud to have supported the Good Behavior Game. This is a program often done in first and second grades where it's a universal evidence-based preventive practice where we've seen great progress. We've done some grants to some schools that had at least 50% free and reduced lunches. And these programs address early aggressive and disruptive behavior, which is a powerful risk factor for later emotional distress. And we've seen reductions in the aggressive and disruptive behavior in the young kids, but then following them over time, children who participate in the behavior game in first and second grade have less juvenile justice involvement, they have better school completion rates, they have less substance abuse rates, and less abuse of alcohol and tobacco, as well as fewer personality disorder and other mental illnesses developing later in life. So that early period, the early developmental period, is so important. We also know that later years are important. So campus, going to college, those young people who don't go to college, that's when we know that a lot of young people are at high risk for suicide. And SAMHSA has been co-facilitating the National Strategy for Suicide Prevention with our colleagues across federal government. And I'm sorry to say that we have now reached over 40,000 suicide deaths in 2013. Right? The number is still growing. And despite our efforts, we know that we can do things with young people to intervene, to follow up, to do prevention work, to create networks so that they can talk to people and get supports, but we don't have enough resources to do it everywhere that we need to. We also know from other countries that there are incredible models where you have primary care follow-ups, where you do really aggressive screening and intervention for some risk factors in middle-aged populations who are actually the highest numbers of suicides, and we don't have the resources to do that either, and that affects families as well. So we know that we need to do more with our campus suicide. We need to do more on suicide prevention in general. Something that we're really looking forward to is another tribal initiative, a tribal behavioral health grant, where we're doing suicide prevention as well as substance use prevention and allowing, this is a 2016 proposal, where tribes would be encouraged to partner with their BIE schools and to address the mental health problems, the substance abuse problems that are showing up in the schools that are getting in the way of tribal youth's academic success. Because it's very hard to concentrate in school for anyone if you've got so many mental health problems, or if you've got trauma in your family or in yourself. That is very hard to get past and to achieve academic success. And we know that's really important for all of our youth, but for tribal youth in particular, there are such significant struggles in those communities. So SAMHSA is partnering, again, with BIE, with IHS, and our other colleagues across the department to do this important work. And finally, as I mentioned, I'm happy to say that this is the 10th anniversary of Children's Mental Health Awareness Day. And so we do hope that you all will join us on May 7th. We're excited. We have Mary Lambert joining us as a special guest, and it's going to be a great, great day. We thank you for helping to bring mental health and substance abuse issues out of the shadows. I think this is a great event, and I appreciate all of your efforts. So please let us know if SAMHSA can be helpful in the future. Thanks.
And so our next speaker will be Jill Diamond. Jill Diamond is the chair of World Boxing Cares, a program that reaches out to impoverished children in 164 countries. Her journey sent her across the globe as an official and supervisor of the championship bouts and as an ambassador for various charitable programs. Ms. Diamond's commitment was recognized with the Boxing Humanitarian Award, WBC's Women of the Year, New York City's PAL 911 Award, and was acknowledged by the California legislature for her work with women athletes. In addition, Jill writes for several media outlets and biography now.
Hello, everyone. I'm probably the least qualified person here to talk about this, but my qualification comes from life experience, I would say. I grew up in a home where my much older brother was quite ill. He was handsome, he was smart, he was funny, and then he went off to college, and a month later he came back, and that was the beginning of the journey for us. The lucky part was that he never hurt anyone outside of the home, and today, many, many years later, he is taken care of in a very wonderful facility where he's safe, and that's considered a success story. I don't consider that a success story. This is 40 years later, and still many children would rather kill themselves than come forward and risk the shame of rejection and stigmatization because they won't ask for help. This has to stop. We can't cure everyone, but we can change our perspective about this illness. So at the World Boxing Council, which seems like an unlikely organization to get involved in mental health awareness, it completely isn't. Many of our boxers, many of our athletes come from very disadvantaged backgrounds. They've dealt with poverty. They're very damaged people, some of them, and they see boxing as a way to elevate their lives, to become normal, whatever normal means, get, reward from their sport. And so what we do, in addition to boxing, is we travel through countries, youth centers, hospitals. Our boxers go in and they tell their stories. And the children really respond to them, particularly boxers that come from their area. They tell them, if I can make it, you can make it. When I get hit and I fall down, I get up. You can get up. They are very fragile people outside of the ring, and they are very open and willing to share their experiences, and I think that it's very inspirational to the people that we come and visit. So out of respect and support to Grace, we're honoring the month of May. This year also, we will be wearing the green ribbons at every fight, including the fight that's happening this Saturday, Mayweather and Pacquiao. We dedicate our month to mental health awareness in hopes of knocking out the stigma. Thank you.
And our next speaker will be Dr. Dana Cunningham. Dana graduated from Southern Illinois University at Carbondale with a doctoral degree in clinical psychology in 2004. Following the completion of her internship at the University of Maryland Medical System / Maryland Veterans Administration Consortium, she completed a postdoc at the Center for School Mental Health. Currently, Dr. Cunningham is the coordinator for the Prince George's School Mental Health Initiative. And I'm not even going to attempt that acronym.
Thank you. Good afternoon, and thank you for inviting me here today. It's a pleasure to be here. And I think you have a copy of my PowerPoint slides in your green folders. So I'm here today to talk just briefly about school mental health and the value and importance of school mental health services. The title of my presentation is about increasing access and improving outcomes. And I believe that by providing school mental health services, that we can improve access for mental health, for youth to receive those services, and also to improve outcomes for them. Just to give everybody a clear definition about what school mental health is or what it looks like, there's some key components to mental health. That's when it's implemented well, we usually see a partnership between the schools and the communities that is undergirded by and youth, and their voices are a part of the work that we're doing. We see that school mental health programs really build on existing partnerships that are already taking place in the schools. So it's not our intention to come in and take over the role of a school psychologist or a school social worker, but to really help support what's already taking place in the school environment. And the goal is to really focus on all students, not just a subset of students, so all students can benefit from mental health services that are based in the school. So there's really a full array of services that can be provided in a school setting, from school mental health promotion. For instance, you might have a broad school-based bullying prevention program that all students, all staff members would participate in. There might be a subset of students who might need more specialized attention and treatment, so perhaps maybe a group of students who may be at risk for a substance abuse disorder, a group of students who maybe have been exposed to trauma can receive more of what we call secondary level of prevention. And then there might be a smaller subset of students who might need more individualized treatment because they are at risk for significant challenges. So what's an optimal place to provide these services? One of the things that I think Kana kind of probably provided a very good overview about the importance of school mental health services is because we know that the onset of mental illness, many mental illnesses begin in childhood, many of them before the age of 18. So if those illnesses go on untreated, there's a significant cost to that. And so, as we know, there's, as was mentioned earlier, there's about 1 in every 5 students have some sort of mental health illness, and about 1 in 10 are really impacted by a significant impairment. But the reality is that many of those youth are not receiving services. The good news is that we know that youth that do receive services, the overwhelming majority of them are able to receive those services in the school environment. So there's research that shows over 75% of students are actually receiving mental health services in the school setting. We know that there's some barriers to receiving mental health care in a traditional outpatient setting. I certainly don't have to go over all those with you, but certainly things like stigma or insurance are barriers, transportation, past experiences with mental health agencies that have not been positive sometimes steer people away from seeking those services in a community setting. We know that traditionally in many outpatient settings, it's in some instances, people after they make their first appointment don't even show up to that first appointment. And beyond that, the most frequent number of times that people actually go to an outpatient mental health center for services is 1. So they may go to that first appointment, but don't frequently return. And so we see over time that many people discontinue treatment or don't continue with treatment. And so that is why schools provide, I believe, a really optimal place providing those services. For one, yes, students are certainly there and it's easy to access them. But in addition to that, there's also the ability to reduce the stigma of seeking mental health services because the counselors are based there in the school. Students can see their friends going to see a counselor, and it's not, I've had students bring students in to come see me and talk to me because they feel that it's a safe place to be, it's a good place to receive services. So it's definitely less threatening. We heard earlier about some of the statistics with depression and suicide. I think being present in a school environment allows you that opportunity to see those students who might be isolated, to see that student who sits in the back of the classroom with their head on their desk and is not really engaged. Oftentimes in schools, the students that we typically get our attention are those that are making a lot of noise, but when we're based in the school setting, it's definitely much easier to also reach out to those students who might be suffering some of those internalizing disorders such as depression or anxiety. So if I had to sum all of that up in terms of the advantages, I would say that when students have their social, emotional, behavioral needs addressed through wellness, prevention, and intervention, there are fewer barriers to learning and more time for productive classroom instruction. And we see that there's really, some people have concerns about the impact of school on academics and say, well, maybe that will take time away from a student's learning time. But we know that if students' mental health needs aren't addressed, they're going to have difficulty learning and difficulty performing well in school. And we do also know through that's been done about the positive impacts of providing mental health services and some of those, the ability of school mental health services to reduce some of those non-academic barriers to learning. So we see that students are more engaged in school, that they can perform better academically, that we see less going out to participate in more restrictive school placements. So in overall improving academic outcomes, decreased dropout rates. So there are lots of positive advantages of receiving school mental health services. And actually, the Center for School Mental Health, where I work, is dedicated to improving the advancement of school mental health practice and policy. And on their homepage, that's listed there, if you can see it on your handouts, but it's csmh.umaryland.edu. But on their homepage, there is a link to a whole list of academic outcomes and impact of school mental health services on other positive outcomes, if you want to look at that. We know as well that school mental health certainly reduces long-term costs. If we think about, the cost of, I said earlier, we talked earlier about the number of students who exhibit mental health illnesses in adolescence and prior to the age of 18. So if those students go on and become adults and have mental health problems that are not treated, what is the impact of that going to be on our workforce, on the justice system, on the healthcare system? So if we don't treat those problems early, long-term, that certainly is going to be quite costly in terms of dealing with those issues in the future. Within our program, we have had an opportunity, I've kind of told you what the research benefits of school mental health, but we've also have simply asked the families and students, what do you think? How have these services benefited you? And some of the things we hear family members have said are that, the therapists are always available. A grandparent said that her daughter was less angry. A case manager helped her get back on her feet. So families are able to certainly see the benefit, and similarly when we ask youth, they report positive experiences as well, that they appreciate having somebody right there. They can get their feelings off their chest. One person noted that it's free, and that was from a young student who actually had experienced the challenges. He saw his mother having difficulty paying for the insurance copay. So he was very happy to see that, there was a service that was available there in the school that didn't require a cost. So just to tell you very briefly about our program, again, it's the Prince George's School Mental Health Initiative. We're based right across the way. We have a few of our staff members here. Thank you for being here. And we're based in Prince George's County, Maryland, and we really have a great collaboration between the Prince George's County Department of Special Education, the Maryland State Department of Education, and the University of Maryland, Baltimore. And the purpose of our program is to really provide more intensive services and supports to students who are at risk of being removed from their homeschool placement. So really focus on that students, but we also do a lot to really help enhance staff training and staff competency, provide some training and family outreach as well. We provide individual therapy, group therapy, prevention activities, really the whole range of mental health services that you could receive in the community. We provide them there in the school. We also actually have a psychiatrist who provides consultation services as well, so it's a very comprehensive program. In terms of the students that we see, as I mentioned, we really focus on students with disabilities, but we also have had a wonderful partnership over the last couple of years with some of the local graduate school programs, and so they also provide services to students who are in general education as well. So we really are able to serve a broad range of students. And you also, I'm not sure how well you can see this in your handouts, but we've also done some research over the last couple of years with our students who've been involved in our program. And one of the things that we do is observations of students' behavior at the beginning of the school year and at the end of the school year, and try to look for areas of change. So one of the things that we looked at, in your handouts, there's a graph that illustrates the changes between that initial behavior at time 1 and time 2, and we see decreasing decreases in behaviors that were off task or negative behaviors such as attention seeking, things like that, over the course of the beginning of the school year to the end of the school year. There's another graph that sort of illustrates an assessment measure that looks at overall problems called the brief problem checklist. And we see changes in those measures as well over the course of the school year. So, you know, it's one thing for me to tell you what the research says, but we also see it, you know, in our students' day-to-day behavior and based on their parent report, teacher report, and the students' report as well, that the mental health services that they're receiving in the school has certainly been beneficial for them and has a positive impact on their behavior. So if you have any questions, I will be available at the end. Thank you.
And our final speaker is going to speak from her personal experience, but I will go through your bio. Currently a management analyst for the international travel team under the Office of the Commissioner at the Food and Drug Administration, Michelle Scott started her federal government career in 2006 as an extramural support assistant for the National Institute of Health, Center for Scientific Review. Mrs. Scott is the vice president of Loud Voices Together Educational Advocacy Group, Inc., a nonprofit organization that aims to connect families and community partners with special education resources to enrich the lives of children. She is also the director of the liturgical dance ministry at her church and a mother of an exceptional young adult who has been able to maximize his potential with the support of programs such as school-based mental health services. Michelle Scott enjoys spending time with family and friends, and her passion is empowering people in order to help them improve the quality of their lives.
Thank you, Bethany. As you read from my bio, I don't feel that I am the most qualified person to be here, but I'm hoping that my story or my experience will be able to enlighten some of you, or at least give you some further insight on what it means to not only the child but the family. I don't know who seemed to have modified what I thought was the agenda, but I'm glad they did, because I'm still kind of jittery from Miss Diamond's story, because I know it. So pardon me, but I'll just try to stick to my reading, because other than that, it is a very emotional type of experience to explain. So again, my name is Michelle Scott. I am a mother of a very talented and gifted child by the name of Heath Scott. Heath started his public education with the infant and toddler program in PG County at James Ryder Elementary School in 2003. After some of my curiosities led me to have him tested for some unique habits he started to display, he was accepted into the infant and toddler program where he received various services based on his initial diagnosis of PDD. At that time, I realized I was going to need as much guidance and assistance as possible to help me navigate the special needs process with and for my child. I was very concerned since I was not prepared for this experience. I wasn't experienced in the area, being a new mother and one who immediately had dedicated what I thought myself to being the best carrier possible. I maintained a very healthy diet. I read several maternity books. I followed all the recommendations of my medical team and made every appointment during my pregnancy. I went as far as to avoiding taking a single dose of medication during my pregnancy out of fear of having any complications passed on to my child. During my pregnancy and afterwards during nursing, I had no idea that I would soon be challenged by the most frightening roller coaster ride ever, after learning that my very precious and healthy baby boy would be diagnosed with a condition that would affect him for a very long time. Well, as this journey started with the PG County Infant and Toddler Program being my only resource, I was very appreciative of the opportunities to have my son receive intervention and other services. I am so sorry. In order to enhance those skills that were not as strong at that time, I stand before you to say that the challenge was not easy, and at times it felt like the hardest fight that I had ever faced. In most cases, the children cannot advocate for themselves, so we become their advocates. And for those of us who serve dual roles, being the parent, it can be very challenging. Each IEP meeting seemed to get very long. My son's IEP list seemed to grow and become more complex, and my emotions seemed to grow out of control. At each meeting, I recall asking for information, guidance, leads, or any resource available to help my son as he matured in age. The response was very slim to none until Heath reached middle school, and I was introduced to a new program, the Prince George's School Mental Health Initiative. The two representatives who sit at that table, wait a minute, I'm sorry. The two representatives seemed to have come out of nowhere. They showed up as if they had been there from the start. They had already begun their research prior to his arrival to school on the first day. I soon learned that this team was a part of a much greater team. They came into my family's life at a very important time. As you all know, the teenage years are already challenging enough. Now just imagine when you have a teenager who has a different way of viewing just about everything, to include how often they need to attend to their hygiene, all the way to why they have to follow instructions, do chores, or adhere to a simple bedtime. Thanks to the mental health services being offered and received in school, we were able to tackle our most difficult challenges with ease and support. Just when I thought I could not take any more, the mental health program was there to provide services such as weekly counseling. There was one-on-one counseling provided to my son in school. The counseling was both scheduled they were both on an unscheduled and scheduled basis, which allowed the mental health team to assist Heath with crisis management and maintaining the skills he had acquired. They did group therapy, which is where Heath would be able to work on communication skills, active listening, friend making, and reading nonverbal social cues. Case management, which is the one that's so important to me. They provided information and resources to us regularly. They even came into my home to be able to see real time what was going on and how they could make, effective recommendations to improve some of the areas that were not going so well. They did stress management for Heath and for us, behavioral management, chore chart, effective communication, scheduling, and they made sure I kept him involved in the community. They followed up with me regularly. They participated in our IEP meetings. They provided support for me and my family. The school-based mental health services are a tremendous asset to youth and their families. It is my hope that all families who are in need will have access to these services in their local schools from kindergarten throughout graduation and beyond. This will ensure that no child is left behind, no child is left without, or just passed along without receiving the services needed to become independent, successful professionals in life. Thank you.
We'd really like to thank all of our speakers for being here. And as Dr. Cunningham said, they'd love to take questions. If you have a question, feel free to raise your hand. You may have to speak up a bit, but I can repeat it into the microphone so everyone can hear. Representative.
I want to be sure that SAMHSA gives us information on where to get the website to be able to find out where that is applicable in the schools. In other words, what programs do you have that can help continue to deliver or expand on service delivery for the youth? We're talking about children.
We actually have a section on our website, I believe, that talks about.
Give it to them?
Well, thank you. The SAMHSA website is www.samhsa.gov. And if you look at topics, there should be a topic on campuses, I think schools and campuses, and that will lead to different places, different programs that we have that focus on schools and have, and then you can go on our grants page. Most of our grants for this year are already out. So our grant announcements for this year, they come out every year in the early January to March, January to April. And so you can see on our grants page what's available right now.
ambience, and thank you so much for that. But my question also is for Dr. Cunningham about, you said that you guys work with, in coordination with the school counselors, the school psychologists, and the school social workers that are already there.
Yes.
You know, in Shorters County, we've got a great batch of school social workers. Can you describe a little bit more about the importance of that link to the school employed person and the connection to school staff, as well as being there every day to identify the students?
Sure, yes. We work very closely with, sorry, I'm short, so I gotta maneuver. We work very closely with the school counselors, the school social workers. You know, what we have found is that, you know, certainly there are so many students who have such a wide of issues and concerns. You know, we find that the school psychologists, while they are there and available to provide treatment, are often very busy with assessments and IEP meetings and all the other things they need to do, so they're not as available to provide the direct counseling and support services. Similarly with guidance counselors, you know, they're also available to be able to counsel students, but, you know, they have schedules and, you know, meetings and lots of other things that are also on their plate, so they're not able to be as dedicated to only providing those therapeutic services and supports as our school-based mental health staff are. But we certainly work in very close collaboration with them. They often make referrals as in terms of students that might need more support or need more assistance. We certainly talk the teachers. Our staff provide an enormous amount of teacher consultation, so helping the teachers, you know, once we only see students for a limited amount of time and then they're going back to their classroom, so helping the teachers understand, you know, how to really help best support those students based on whatever issues or disabilities they might have, and to really help support them in the classroom as well in terms of implementing some of the strategies that can help them be successful.
But anyway, I have two questions. One is, I haven't heard anything or conversation around dual diagnoses or multiple diagnoses. There are children with disabilities who also have mental health, and how we address that situation in the school systems. And there was a young lady here from the representative from Minnesota office. She's an intern, and she has a mental health illness, but she just left, and she was just saying how she's having a problem with her professors understanding her disability. And I'm wondering what we are doing on college campuses to train professors in reference to working with students with mental illness and all disabilities. And I just came from the local government, and training professors at universities about what disabilities are and disability sensitivities really helped out with them understanding the reasonable accommodation that their students needed. And I think that's missing in this conversation on college campuses, because professors think they know everything. I love all professors. But when they hear, I know that when I train professors about disabilities, the light bulb went off, that this is a chronic illness, there's episodic illness, and that, you know, sometimes these students get up in the morning and they cannot come to class. And you need to understand that, and we need to work with you to do that. But college campuses, professors are, where elementary, middle, high school, those teachers may be getting it.
So I think with our programs, we know that we work very closely with the Department of Education and with the folks at Administration for Community Living in the developmental disabilities and disabilities world largely. And we recognize that kids with behavioral health problems also, many of them have co-occurring disabilities, whether cognitive or physical. So our systems of care programs absolutely take that into consideration in terms of all the needs that those young people have, and and many of them have multiple vulnerabilities in that sense. So I think our SAMHSA programs definitely do that. With respect to college campuses, the main work that we're doing right now on campuses does have to do with more particularly suicide. And so I would say we don't really have something in the space that you're talking about. However, I think the good thing about the suicide programming is that it does increase literacy about behavioral health issues. And so that is, I think, a first step in terms of understanding what is the kind of impact that these things can have on young people, and therefore, what do you need to be on the lookout for? So, but I hear you, it's a great suggestion.
I just want to add as well that Center for School Mental Health recently partnered with a few different organizations, but they recently developed a series of online training modules, and one focuses on co-occurring disorders, and it's free. Anybody can log on and take it. So if you go to the center's website, there should be a link to that as well. I think it's Maryland Behavioral Health Online.
Hi, Napolitano, Mental Health America. Thank you all for sharing the stories and for being here and making our job as the steering committee so easy, because you so articulately really told the story. And one of the points that really jumped out at me today was when we talk about kids, they don't come all by themselves. They come in units. So Kana talked about the good behavior day and the classroom. And you spoke about helping the families. We heard from the point of view of the program and the point of view of the parent, that it's the child and the parent. Can you address how we move our systems more towards understanding that kids aren't all by themselves and we have to deal with families and communities and classrooms?
Yeah, I think that's certainly an important point. You know, one of the things I always talk to parents and teachers about is that, you know, it needs to be a effort. We can't solve all of these problems by ourselves. And so, you know, we do need the families on board and engaged. We need the school staff engaged. And sometimes, you know, due to a lot of other issues, it's hard for people, you know, sometimes it's hard for us to, what I usually say, kind of play nicely together in the sandbox. You know, sometimes we have competing agendas, but it's important to, you know, always bring back the focus to the student. And, you know, together we can certainly do more than we can in isolation. But I think it's just important to really get that message across that it really does require, you know, the whole village and the whole community to work together. You know, that's where we really see the programs that have the most success, is when we are able to partner with families and partner with community agencies and in the schools, and not work in isolation. Sometimes you may see programs that may sort of set up shop in a school and they're in a corner in the office, but they're not at all engaged in the larger school community and engaged in what's happening in the school. And so it really is important. It makes a huge difference when you do have those collaborative partners and collaborative relationships.
Deb, I'm sure, as you know, there's nothing that SAMHSA does that doesn't involve bringing other partners to the table. For our work in the children's mental health space, we think that everything should be youth-informed and family-centered. It should be culturally competent, it should be evidence-based, it should be trauma-informed and recovery and resiliency-oriented. And so one of the challenges we hear, though, from communities and from states is that applying for some of our opportunities is that much more difficult, because now we're starting to require you have to bring your Medicaid office to the table. You have to bring housing to the table, employment, labor to the table, because, you know, kids with behavioral health conditions as their leading cause of disability have the lowest rate of employment and the highest dropout rates. So, you know, it's needing to bring together all those partners. So we definitely see it, but I think there needs to be a social shift, because the state says, sure, mental health substance use, maybe we can get child welfare to the table. Obviously, the schools are sometimes hard to penetrate because the teachers are very busy. You know, school administrators have a lot on their plates. And then, you know, once you get to Medicaid and housing, I mean, it gets that much harder to bring all those partners to the table. And until everyone understands how central these issues are to their line of business and to their bottom lines, it's going to be hard for them to pay. You know, they're all busy. So how do we get them to have the bandwidth for that? And I do think that there's a national effort that's needed by all the folks that are in this room to keep that drumbeat going about how important it is.
So you're asking, do I know of programs that do?
Are there any, and we're also looking for ways to help promote this and, you know, help advertise that this is happening, and also work together with other programs that are offering services, because these services are sometimes offered in our school-based health schools.
Right, yeah. I know you guys are working with the Center for School Mental Health, yeah. So there certainly are programs that are doing that collaboration and doing it quite well. I don't know if you're looking for kind of a list or.
We can talk later. I was
Okay.
just wondering if there are some out there that we need to start tapping into, if we need to reach out a little bit more and help you all promote, as well as vice versa.
Well, one of the things you need to know is, in California, and again, we're on the other spectrum of the U.S., but the program that we started back in 2001, is mental health in schools. It's went from 1 high school and 3 middle schools to now 26 schools. On-site clinician delivery to do with all the issues that we were talking about. And the bill was patterned after the program was set up then. What has happened since then, we have formed a mental health consortium. And this is of the mental health individuals who want to work together to let one other know what they're doing and to help each other. So they evolved into, well, we started off with, I don't know, first it was health and then went to nursing and now it's mental health. And it spun off into 4 categories. Veterans, children, help me out. Women's and policy. And they help us when we did the Affordable Care Act. They looked at the portion of mental health and recommended the one thing that was missing, and that was the language competency. Because we need to be able to ensure that it's delivered in a language that the parents can understand, never mind the child. The parents has to be able to be involved, as you have said. That's been ongoing. It meets quarterly. They have done a beautiful job in helping each other. It's become a county. We have speakers coming from the county, from the state, mental health providers, parents. They come in and talk to us. This is in LA, Los Angeles is where I represent. But it's something that you can do, is you can start building, and I suggest all work and be able to carry out things similar to this. It is inviting the parents to come in and listen. We had a journalist from the Washington Post, Jaffe, Mr. Jaffe, who's bipolar, and he's a very successful individual, a journalist. People who are willing to come out and say, look, I've gone through this, and this is what I've done to be able to overcome. Well, those are messages that the parents and the children can hear. Ron Artest, Laker, came in and said, hey, look, you know, I'm playing ball because I've been able to deal with my inner demons, that parenting and anger management and all this other stuff because of my psychiatrist. Openly, after the championship. And he started the foundation where he gives money to mental health clinics and to schools. So this is, you've got to reach out, you've got to start digging, you've got to start making phone calls. And people here who have an interest can sometimes connect with somebody else. And this is something, this is what unites me and Jill, is that she has a passion for it because of the boxing influence in the mental health. The Boxing Council gave over $1 million to study brain trauma. Well, guess what? It helps us be able to identify some of that. So you just got to dig a little bit, and you got to put it out. You got to do your own networking in your own area with your parents, and have them become advocates. Because without them, you can't change policy, and you certainly don't get the funding unless there's a pressure there to make it happen. Then you talk about you said mental health caucus. That's been dormant for 1.5 years. I can't get Mr. Murphy to revive it, so we've asked Mr. Gibson, who you met today, some of you, to become my co-chair. The consortium, and then of course suicide in universities. One of the highest is in universities. We don't talk about it. And the issue is the pressure it is, you name it, and I'm not an expert so I can't tell you, but that is one of the highest suicide rates in universities. So somehow we need to be able to convince the university to have the programs to be able to educate not just the student but the parent, because they deal with the child, maybe not on an ongoing basis, but certainly for the money, I would think. And of course, don't forget, the Affordable Care, it was supposed to give us parity in mental health access to mental health support. Well, if there are loopholes, you got to tell us, because we can't change unless you tell us where the loopholes are to be able to ensure that everybody has access to mental health services from our providers. So with that, I thank you very much. God bless you.
Do we have any other questions?
Yes.
Okay.
My name is Jennifer Thomas, and I work at the Institute for Educational Leadership within the National Collaborative on Workforce and Disability, which is a technical assistance center housed at the Institute. I want to first just thank you panelists for sharing the information that you have with us today. My question is in regard to our Youth Action Council on Transition. We have teams in different states across the country, and those teams consist of 2 youth and adult partners in a sponsoring organization that work together so that these youth are able to lead but learn about youth adult partnerships and how to actually partner with the adults to implement different policies or in their local communities. One of our teams is located in Indiana. They are very focused on the mental health system and how to make improvements. And one of the youth on that team is interested in starting support groups for youth with disabilities and who may have other mental health concerns. And she's thinking that hospitals might be a good setting as well as schools, because she talks about how her own experiences and how she had been hospitalized and just the different stigma that occurs. And so my question is, are there any resources you all can provide that or point me to that I can point her to that would be helpful for her this youth-directed or youth-led support group around mental health concerns so that she's aware of all the different issues and thinking about other things that maybe she hadn't thought of as of yet in addition to her own concerns?
Really wonderful and inspirational is Youth Move National. So you're already familiar with them. Also Young People in Recovery for those who are in addiction recovery. And I think those would probably be the 2 best for those with lived experience. And then another group, which also speaks to Congresswoman Napolitano's concern about what's happening on our campuses, is Active Minds, which is another wonderful group that's doing a lot to educate folks on college campuses about the issues around mental health.
Yeah, it's, how about the state? Does the state have any programs? Have you contacted your state to find out whether they have operating programs? The state mental health office?
Jennifer, I'm sorry.
Yeah, have you contacted your state providers? Do they have a mental health department that you may be able to see whether they have any funding to be able to carry out what you're asking for?
That's a good question, and we can definitely, within my office, probably work with them and their team to help figure that
Do
out.
you know of anybody in that state that you might be able to direct her to?
Because they're in that particular team is in Indiana.
Yeah, we can try to connect you with folks in Indiana, both whether we have a Safe Schools Healthy Students grant and we have relationships with the folks that manage the mental health block grant. And there's probably a child or youth coordinator for the state, so we can try to make those connections. Yeah.
And,
And Jennifer, this is Dara. You know, they can always contact me, and Indiana has a great, and that CAMI board is excellent. There's several people on that Indiana CAMI board. Okay.
and I want to ask Jill, because
Oh, you know, I just always thought that it's the problem sometimes to young people is that getting emotional counseling isn't good. I mean, if you have a flabby body and you go to the gym, people always say, yay, you lost 100 pounds and how wonderful it is. But if your mind is a little flabby or something, nobody ever says, oh, I just finished therapy, you're doing so much better. No one. So I'm thinking of if we could develop a hip way to think of for kids, like calling it mental gymnastics. So you can either go to gym or mental gymnastics, or some way that, you know, out of the box that people would actually think that getting therapy was a hip thing to do. You do it for your body, you do it for your mind, and then you become a super person because you have it all knocked.
great, thank you.
Other questions?
Any comments, anybody? Would you like to see something at least happening on a quarterly basis? Well, here's the kid that's gonna help make it happen. This is Jonah, and most of you have maybe either talked to him, and now we have a volunteer, Ron, that is getting involved. Where's Ron? There he is. Ron, that's helping out. And I take volunteers because this is something that is so critical, especially with children. That's my soft spot. I have 4 great-grandchildren, and to me, there's nothing more precious than seeing them evolve, healthy, and sane. So Jonah is here to help, and so am I. All of you, my suggestion is that maybe you share. If anybody wants to put on a card whether you want to share your information with each other and become a network of assistance to each other, please feel free to do so, because you are the one that have to move the ball up. It isn't up to me. It is you that are going to make it happen. All we can do is try on this end, and unfortunately, we're short of funds in SAMHSA, we're short of funds everywhere, and the climate here is not conducive to us being able to push the agenda for my bill or any other mental health bill. We tried it last year, it failed. There's no way that there's a mental health bill that's going to be on the no, because they won't allow any funding for anything that isn't already programmed. So we need your help. Just keep us together, and we'll be happy to work with you. Thank you.
And I know that the founding partners would like to extend special thanks to Jonah for putting up with us and helping us organize this wonderful briefing. So, we'd also like to thank our supporting organizations, other national agencies that supported our putting on this briefing. And I think that one step we can take forward, at least, is supporting Representative Napolitano's mental health in schools bill. And so I'd just like to say thank you for everyone for coming and listening to us on this incredibly important topic, and let's follow up with all of the suggestions.